Dr. Kamran, and the audience. So allow me to share my slide, all right? Okay, can you see it clearly?
Yes, ma'am.
Okay, right. So the title of my topic today is Empowering the Silence During the Pandemic, Building Resilience for a Better Tomorrow. So what I will share with all of you today are some of the initiatives we did, okay, my student and I, as well as some colleagues. Yeah, to empower the silence.
Please mute your mic, please. Students, please mute your mic.
I think they are excited. All right. Yeah, to empower the silence during the pandemic. So what you will listen and see purely come from our observations, our conversations with the silence, and also our engagement with them for the past, I think, close to 2 years. All right. So let me begin. Okay, I have only 3 parts of my presentation. It will not take long. This is just to, you know, share what we have done in the field. All right. We hope that, okay, we hope that we can inspire, you know, people in Pakistan or other parts of the world. Perhaps what we have done are similar. If there are slightly differences, perhaps it is, you know, based on our circumstances and also social context, all right? Now, who are the silence? Who are the silence that we have assisted or we have empowered? So the team identified 3 groups, okay? The first one are people closest to us. They are our family members, our own parents, our siblings, our friends, even our neighbors, our spouse, and our children. The second group, okay, are the work, what we call the work relationships group. Our bosses, you know, our peers, our co-workers, and last but not least, other people who we see them on a daily basis, although not many.
Excuse me, Dr. Noora, please wait. Your mic is mute. Your mic is mute.
No, I think you mute everyone, so you mute including me.
Okay.
Right, so can you hear me now? All right, so the last group of people we empowered are those people we meet on a daily basis, the bankers, the clients, suppliers, some cashiers, the janitors, although not many, but yeah, they are, what is this? They are being empowered too. Now, let me go to the next slide. Okay, why we choose to empower this group of people? Because of several reasons, okay, because of several reasons. This group, they deal with a lot of sensitive issues, among others, for example, abusive partners, marital relationship. They deal with mental health issues, depression, and what we are doing now here in Malaysia to deal with the issue of menstrual poverty. We have come across also people talking about their plan to commit suicide. They are very weak, and many others, which we don't discuss openly with you know, other people or on the street. So it's very sensitive. Most of them feel they are defeated by COVID. They are helpless. They cannot do much compared to previous years. Some of them hated themselves, okay, for being incompetent. Self-loathing is very, I think, very obvious. And then what more, they have to deal with some cultural expectation, cultural beliefs. Okay, you have to be strong because, you know, the culture says we have to accept this. This is a part of the test from, God, and, some restriction, cultural expectation, the social media, the media, and all the negative images about, them being, constantly showed and shared, in Facebook, um, Twitter, Instagram, and many other platforms. Right. So this is this is some of the reasons why um, we think that we should do something, right? Not only doing something, but understand them better or more. Now, here are some of the silent narratives I decided to share with you. There are actually hundreds of it, but I'll just pick 4 here just to show to you the intensity, of the problem that they face. I have, these are all real cases, okay, but the names that appeared on the screen are not real name to protect their privacy and confidentiality. So one of our students, okay, quit university, abandoned her study just because, okay, she is different. According to her, she's different from her friends, okay, less participative in the classroom. Not only that, there are times when she misses the lectures, okay, she's not able to submit assignments on time. So I'm different now. Okay, I'm anxious, I'm weak, demotivated. Actually, there are more, right? And I'm not sure if her friends and lecturers, including myself at the time, okay, understand the situation. All right. We have also, Ali here, who is an executive in a bank. When he was laid off from a job, okay, he feel incompetent as a husband, okay, as the breadwinner. Okay, so what happened to him is that, all sorts of bills, loans, in fact, paying for food, children's tuition and fee rest on the shoulder of his wife. So I think this machoism is still there. Okay, man, you want to project yourself as, competent. You can do everything you shoulder, but there are times, especially during crisis, things are not, it doesn't happen the way you expect. So the feeling of guilt, okay, he feel sorry that he has to shift, okay, the burden to his wife, and obviously it is not enough. It is not, the money, okay, it's not enough, and it is not sufficient. All right. And then a mother that I spoke to, she says that, I've changed. Unfortunately, my husband did not notice that. He noticed, okay, I have changed in terms of physical, blooming, ballooning, okay, that is obvious. But, inside, the husband are not aware, or perhaps, okay, enduring a pain, enduring, all sorts of challenges, okay. You should you should keep it to yourself, okay. Find your own way out to your problem. Okay, so there are too many things on my plate, my work, my meetings, okay, not to mention also conferences, okay, the kids' online classes, their homeworks, okay, kitchen, laundry, gardens, you name it, okay, the list goes on and on. So for some men, they struggle to grasp, okay, what is actually taking a place, okay, or how much, okay, their wives, have changed due to the pandemic. And last but not least, okay, we have this one interesting narrative by a girl, okay, attending high school, okay. It's very sad that she has to she has to miss her classes. Okay, when we inquire further, what is the reason? Okay, what is the reason? And she said that I don't go to school because I don't have enough money to buy menstrual pads. All right, so it is at least 7 to 10 days. Okay, she stays at home because she don't have money to buy the menstrual pads. Why? Because my parents have to spend more every month to buy pads for me and my sister. Imagine if you have 3 or 4 daughters, the cost to buy menstrual pads are even more. All right, so these are some of the narratives, okay, which were told, okay, shared to us. And yeah, we are surprised. Okay, some of it we expect. Them to behave this way or to feel that way, but some other stories, okay, it's very heartbreaking. All right, now empowering, okay, empowering to us, to the team, empowering people is a process of both personal and also community. And I think you will agree with me that empowering a process is full of ups and downs, twists and turns. Okay, in other words, it is not a simple undertaking. Why I say so? Because there are times we are, questioned or reminded of, our boundaries, how much we can empower people, or in the first place, do these people want to be empowered? And then we are aware that powerful groups also dominated in the process of empowering the silent or vulnerable groups. A little bit of political intervention we have to face, and it's even more challenging that the group that we empower still stick strongly, adhere to their unique adat or customary laws, rituals, and then we have, yes, language barriers, lack of infrastructure, and also skills. So I will not go into that today, but what I want to share with all of you is that empowering is a process of, we learn new things, okay, and then we unlearn that and we relearn, meaning we learn about them, their situation, their reasons, what matters to them most, and along the process, okay, we need also to filter and screen the information we have previously about them, to have a fresh perspective about the issue and how we can best address their problems. And okay, we move to relearn about them and the whole thing. So we continuously analyze, evaluate information, circumstances, we see what appears relevant to them, and we need also to update our information from time to time. All right. So this is the second part of my presentation today, is what we can do or what we have done, okay, taking action. Now, what we can do, you can begin with, simply listening, okay, listening to learn. One note on listening, we hear differently, okay, we listen differently. And the people we talk to, okay, in the field are not just telling us stories. This is, a reminder to all of us here who plan to empower whatever group out there in your country or in your society. So they often come to tell because they believe that their stories can awaken us to see more, to do more, okay, to do more, to put more empathy, to become more present, to those around them is, and perhaps to love and to care more. So when they come to you or you invited them to open up, tell their stories, it's not only listening here and it goes out there. It's not only listening so that you can capture the data and write, publish in articles. No, listening to learn, to understand, and to take action. So the stories they tell requires us to engage, requires us to inquire. Yeah. All right. So sometimes the stories we hear or I have heard bring forth a knowing that our lives are intertwined with definitely a lot of things, the culture, the politics, religious interpretation, understanding, yeah, economic constraint, education, healthcare, whatnot. And yes, that lives are always complex. All right. So the question here, when you talk about listening, is can we really hear them speak? Can we really hear them speak? Or do we only hear what makes sense to us, what is pleasant to listen to, based on our ways of thinking and social circumstances? At some points, ladies and gentlemen, we could not hear them. Okay, we could not hear them. It's very unfortunate. Why? Because we depended. Okay, we depend when we listen. We depend. We rely so heavily on dominant frames of understanding. And ways of communicating that make us, I do not want to mention this, but I think I have to, make us blind and also deaf. All right. So I think this is something that all of us here can look into it further. All right. So next is be empathetic. As humans, we all experience different lives and encounter different challenges. It is important to truly feel empathy for one another in this life, together as a group, together as a community, together as what is this association or clubs. All right, show more empathy into their situations. We need to prioritize their words, their stories, and truth, not our interpretation of them. They are weak, they are, they are bad, they are this and that. So empowering these people is not just, a slogan, it's not just a campaign, but it is actually a way, or you want to put it as a way of life, particularly during this pandemic, time. The third thing that we did, or we can do as members of the society, is become their ally. We engage with them. Okay. Satisfy the deepest needs. So what are their needs? Okay, well, perhaps, perhaps we overlook. Okay, we only go on the surface. They need money, they need menstrual pads, for example, they need jobs. Okay, but actually the deepest need that each person requires is, the self-esteem, the sense of being important, the sense of being valuable and worthwhile. In good times and also bad time. So everything that we do to empower these people in our interactions, in our programs, in our, well, perhaps some policies, okay, with others affects their self-esteem in some ways. All right. So I have put here that to empower the silence, we must continually. It is not only a periodical thing. So once, once pandemic is gone and that's it, okay, our empowering duties are already expired, okay. No, we can, keep on doing it, okay, because we believe the outcome will be very good, not only to their, to them personally, but to their overall, health and well-being. Okay, so we need to look for ways to make them feel valuable and important. After all, they are the members of the society. All right. So what we should do, okay, we should educate our youth. Okay, we should educate our society, members of the society, and yes, we need to create the culture. So what are the things that we have to do? Is action speaks louder than words. Okay, it is through our actions, through our behaviors. Whose behaviors? Okay, many of us here. Perhaps you are the VCs, you are the head of department, you are team leaders. Okay, team leaders. Okay, we have to together show that, okay, we care. We are interested to help them, and you will be surprised that building good rapport will increase their trust. Okay, their trust. I mean, the trust of the silence towards them is okay. Next, okay, next, we need also to show them, okay, tell our students, okay, tell our community what we pay attention to the most. And okay, we pay attention to, for example, their children missing a school. Okay, we pay attention to women, okay, housewives, okay, housewives who have to shoulder the economic burden because their husband lost their jobs. Okay, so we pay attention to what, to providing, okay, perhaps reskilling, skilling talents, and many other things. All right, and this, okay, and this will create a culture of compassion. Okay, you care, you love. Okay, we live in this world, not only we are alone here, but we need other people as well around us to do things. Next, okay, put into your activities, your life, more values. I'm not saying that we don't have values. Oh yes, we do have, but perhaps during this challenging time, we emphasize more, okay, of that particular values, but values that you embrace, values that you believe will make things better. All right, so we show, okay, we show to them either the group that we want to empower, or okay, the team, okay, that help to empower, particularly the students, okay, our youth. Okay? I tell my student this, okay, what is accepted and what is appreciated, and that you have to you have to identify the values that is everyone agrees upon. And yes, we have no problem embracing that values. And last but not least, to show that we are responsible, we take action, allocation of attention, our time, okay, our time, how much time we are willing to, okay, listen to them, how much time is spent to assist them, to provide resources, and also the need that they help. So all these things are very crucial when you want to, empower the silence or vulnerable populations or a group. Okay. And these are some, okay, of the initiatives, okay, the NGOs, government-linked companies, right, including my university, not only my university, but I think the entire nation, other universities as well. So we have this campaign of raise a white flag. So whenever we see a white flag, okay, in in front of their house, the gates, the doors of their apartments, right, we know that, okay, this is a plea, a cry for help. So whenever we see this, okay, we will send food, for example, okay, the food basket, anything that they need, right? So we make this known, okay, we make this known to the entire society, the entire nation, including people at the university. We have this Mr. Dollar campaign. We provide them with basic, staple food, the rice, okay, the rice, oil, eggs, whatever are necessary. And then, yeah, feeding poor families, okay. And we have also campaign to help girls, okay, girls and some females out there who in dire need to purchase their menstrual pads so that they can go to school. they don't miss classes, okay? They don't miss some classes, their subjects, all right? So we have the period poverty fundraiser. So this is what looks like in that bag, all right? And for women, okay, we get them to participate actively in digital entrepreneurship. If they can cook, okay, they can sell those thing and make money directly from their kitchen, all right? Now, last but not least, all right, having spent our time, okay, listening, talking to these, people, we have, four reflections. Okay, we have four reflections, and I think it is very important to me personally, and also to the team collective family. Number one, we need to get them to, open up. Why? Because if they share their story, it will bring a stop to any problems, at least to a certain level. Definitely, we will not solve their problems, entirely, but at least, okay, but at least to get them to function, in a normal way, so that they can lead a decent life. All right. And by opening up, we need to, it allows us to maintain a positive well-being, and it's an opportunity to listen to voices of difference. You might be surprised that all this silenced, okay, this group of people are just, around you, in your office, okay, in your classroom, in the neighborhood, very close to you, and in your own family. Empowering the silence definitely involves, a lot of emotion. There's some highs and lows. Okay, it's a very emotional distress experience. Okay, because you talk about something sensitive. And yes, it puts a lot of pressure on the group that we help, and also our team, my friends and I, okay, my own student. We believe that, okay, we believe that empowering the silence needs a synergistic collaborative. You cannot work in silos. These people too, they cannot assume that the next day, if you don't, seek help, open up to, people like is things will be better the next day. No, it involves, partnership. We need to, as I said just now, we become their ally, their friends, and we put more focus on people's development. Next, last but not least, we are giving hope. Okay, to me, there's hope when people start to open up. Okay, and we are prepared to empower people. We are giving hope. We need to take action, and we must be grateful. We must be grateful. Either we help people, or they are helped. So it's a two-way thing, and both of us, okay, whether the silence and and the one who, okay, wanted to help, we need to be ready to grow together, okay, to grow together. So my take-home points for all of you here, there are only two things, okay. Number one, never abdicate to empower the silence, okay. We cannot live in silos. We cannot expect that if we if the silence come up with their own way of doing things, perhaps they are making the wrong choice, all right? So it's a collective and partner efforts. Empowering the silence is a collective and partnered efforts, okay? We work together to solve problems. We do things together because we care, we love one another. And the last one is perhaps as a privileged academics, as a privileged student or activist like all of you here, we need to diversify our efforts. We need to restructure how we think about people, how we do things, okay, how we overcome obstacles, our self-awareness. We can question, okay, questioning the questions we ask, and many other things. All right, so with that, thank you very much. Assalamualaikum, and have a nice day.
Thank you, Dr. Noora. Wonderful presentation. Okay. On, I want to tell you guys that the question and answer session will be at the end of the session. Please note down your questions. You will be allowed to ask question by raising your hand option in Zoom. The reporter will unmute your mic and you may ask the relevant speaker. Moving on to our next speaker, Dr. Nazia Rafiq. She is a lecturer, Department of Sociology, Peer Mahal Ali Shah Agriculture University, Rawalpindi, Pakistan. She has done her PhD from Quaid-e-Azam University, Islamabad. Her topic of presentation is assessing the impact of socio-economic problems on families of thalassaemic children, a study of institutes of Rawalpindi and Islamabad. Dear Dr. Nazia, I request you to please proceed with your presentation.
Yeah, thank you so much. Let me share my screen with you guys. Just give me a moment, please. Okay. I hope you can see me now, my PPT.
Yes, ma'am.
Okay, thank you so much for providing me the opportunity to speak with you guys. And
Excuse me, ma'am.
Yes,
And
please.
kindly isko PPT view kar le zara.
Yeah, okay. It's fine now?
Yes.
Okay, thank you. So first and foremost, this is a very prestigious occasion where we all are gathered here to talk about different issues. So I would like to connect from Dr. Nora Zora's presentation, which was very impressive, and which calls for and in which she is urging the collective role of collaborators like academicians, I mean different policy makers, community people, because they are the real stakeholders. So we need to have a synergetic approach and collective efforts to combat with any health issue or social issue, and to precise this thing. Here we are talking about the medical issues. So it's very important that how we carry the message forward from this platform. So here I am going to share with you one of the study that was done by one of my student and myself, and a team which worked on a paper which is currently in progress, and we have already published a paper. I mean a couple, 1.5 years ago, that was about a CAP study about thalassemia and its prevalence and how people people understand it, what are their reactions, what kind of knowledge they have, and what kind of perceptions they have, and how they are prepared for the disease. This is basically an exploratory type of study. And in this particular study, where we all know that this is a genetic based blood disorder in which the patients face acute blood deficiency and severe kind of anemia. So this is basically inherited, and the profile for this this disease, particularly in the South Asian context, and in Pakistan, it's not that good. And because as you can see from the slides that more than 70,000 infants are born with beta thalassemia worldwide, and out of which 270 millions are the carriers of different other disorders of blood related diseases. So we can connect it with other diseases like HIV and other kind of infections that blood can cause. So that is a later stage. But just to give you a picture of the sorry, let me mute my phone. Sorry, it's bothering me. About 50,000 to 1 lakh children die due to thalassemia in low and middle income countries like Pakistan, and 7% of the world population is carrying this disease or disorder, and the life expectancy is low, particularly in these countries. However, it has somewhat advanced up to 50 plus years, but in countries like us, the developing countries or the third world countries, it is just up to 10 to 12 years, which is a sorry picture which we have to just accept. And with this, we have to accept that what are the barriers which we are facing. These barriers are of multiple range, and multiple things are happening at multiple levels. For example, I will be able to figure out some of them, some of them are social, some of them are psychological, and the economic burden that this disease brings along with it. See, health is the situation that everyone wants to be healthy. And when we are talking about a healthy society, healthy nation, and a healthy country and a healthy globe, we are really concerned about the well-being of a person, well-being of a person, individual, family, household, and commitments. I'm in a meeting, please. Sorry, I'll see you later. Okay. Sorry, I am in a public office, so sorry for these interruptions. So what I'm saying is that health is a physical condition where everyone wants to not just being healthy, but also is concerned about the well-being and a healthy contribution to the society that can bring ultimate change in the society where they belong, and to the world also, and at the national level also. But when we have similar kind of problems that are hampering actually an individual, because as Dr. Nora mentioned, that every life is precious, every life is important, and we are the ambassadors of life, and we want to save life, we want to save the environment, we are talking in different domains where health and lives can prevail safely and in a healthy way. So so these are the things which are actually bothering the country, and these are the things which are actually in Pakistan, in context of my country. It's Dr. Nora, this is one of the under researched topic, because we usually gather on very special days. We usually celebrate, for example, Pink Day, we celebrate Cancer Day, we celebrate so and so day. But the problem here is that the information does not reach the grassroots level, because my country is a country where our education levels are quite low. The overall literacy rate of the country is 63%. It means that 60 million of the population is uneducated. So the message is popping that you cannot see my screen. I don't know what is happening, but just to continue, this is the situation. And here's the country where there is a lot of gender disparity and a lot of factors that are associated with gender, culture, norms, religion, and other things which are happening at the societal level and at the community level. So when we are talking about a disease, it's not a person who is actually sick. It is not a single unit. When you have to talk about disease, you have to talk about in a broader framework where you have to study the household as a unit of analysis. So when you are talking about the household as a unit of analysis, that household gives us the gloomy picture that what kind of sufferings they go through, because nobody wants to have an unhealthy child or a person with thalassemia, or a child with thalassemia. But this is something that happens. The reasons are different. Some are of course they are biological, but there is no such norms of going through any kind of screening. When you talk about screening, our data showed that there are certain cultural barriers, because you only come to know about your disease by incident or by the happening or the event itself, which is not a very healthy sign. Because if you talk about going through any kind of screening for a girl before marriage, it comes up with lots of stigma and social humiliation for the entire family. Why is the girl going for or the boy is even going for screening? Because it's not taken positively. The negative things associated with any of the things gets public when it is rumored, and when it is talked, it becomes the talk of the neighborhood, relatives, or anyone else. Then the things become very difficult to handle, because you see, as I mentioned, that education is one, if I go at the core of the problem, then you see education makes a greater difference, because people with better education and better information and better access to the information and the channels of treatment and different sorts of mechanism, they are better able to understand, respond, and then to react positively. But I'm talking about the general people who are coming from a society where they are just earning, I mean, 1,000 rupees per day as a wage, and then they have a huge families, and they are under huge social and cultural pressure, where they believe that the more number of children that each family has, they means that they have more hands, they can help them in agriculture, they can help them in household chores, and they can help them in so many different things. But on the other hand, when this thing is not being even imagined, this is beyond their imagination. I see there is a family, and their child is a thalassemia major patient, but the mother never knows and the father never knows that what is happening and which is the appropriate form to address that thing. They only recognize it through the paleness and I mean lethargy of the child. But then what they do is that they all of the sudden jump to the different channels which are not appropriate. For example, they may rush to a saint that something has happened and just do some magic and my child will be fine. So other thing is that they can also go to quacks, and they are not ready to accept that it can be a disease, because the reason is that they're already not aware of this disease. How come that they can understand? So this is what is happening at the grassroots level, at the village level, at the community level. And when they discuss with their peers and their friends or their relatives, they also have the similar kinds of minds and tradition. So they take a real good enough time to get to the proper channel and proper health facility. So whatever happens is that the time lapse between that situation makes the situation adverse. So so if we see I have already spoken about this, that the world has significantly worked on this thing, and they have raised the life expectancy of such patients, but it remains critically low in Pakistan just because of the factors that I'm mentioning here. And people are more vulnerable towards this disease because of its non-treatment, non-screening, and not preparedness. Okay, then if you allow me, I can roughly divide this thing, and for this study I can divide this into two aspects. One is the direct cost of the disease, which when identified a person has to bear. And I mean, for this study 2 institutes were chosen, and then I'm just skipping these figures, you can just have a look at this. So what this is the methodology that we use, that we took a sample of 410 respondents through stratified random sampling, and then those were the children's, and we studied their families through semi-structured questionnaires, selected case studies, key informants, informal discussions, and later on this data was analyzed. So from where these I mean families were chosen, there's a university now that is also known as PIMS, Shaheed Zulfikar Ali Bhutto Medical University, and other is an NGO that is Jamila Sultana Foundation. So the respondent, sorry. So this is this is where the I mean the respondents were I mean touched upon. So here I'm discussing about the monthly expenditure on the treatment, and I was also mentioning about direct and indirect costs. This is the direct cost, which they mentioned that some of them mentioned that they spend, I mean, less than 5,000 rupees, 5,000 to 10,000 rupees, and so on up to 30,000. This is the expenditure that goes out of their pocket for transfusion, for transportation, for their accommodation, and for so many their food. And these all are the things which we are expecting from I mean low income social group people, where they can hardly or barely afford their I mean routine income expenditure that they require to run their families. So it becomes very difficult for them to I mean, just cut their budget from their household, I mean, expenditure, and invest it on disease or coping of a disease of a particular child. And let me tell you that when you have certain child in a family, it's not just one child. There are, I mean, 2 or 3 children who also carry the same diseases. For example, I had a case study where the person who is whose name was Asif, I'm using a pseudonym. So he was a shopkeeper. He was running a shop in his village, which was his only mean of earning. He had 3 kids. One of his kids was like diagnosed with thalassemia. What happened was, when he had to come, and he lives about 200 kilometers away from the major thalassemic centers, which somewhat provide free treatment. But what free treatment is, I'm talking about the direct cost, which might be free, but what about the other cost which he has to pay? Because he has to, for 1 day or 2 days, he has to shut his business, he has to close his shop, and then he has to manage the earnings for that day, and then he has to travel all the way along with the kid, along managing the other kids, and then along with his family, to take care of the child and bringing into such medical centers and medical facilities. So it was really a cumbersome process, because people are not ready for such risk, and they don't know, and there are not sufficient hands to help people at different levels. Because, for example, when the disease is new, and then when the family explores that it is a disease, so what happens is that initially people become courteous, they extend their help, and they give blood donation. But what happens is, with the passage of time, then people just they try to avoid them, they try to ignore them, they try not to interact with them there, so that they might not ask them for any kind of help. So these and the parents feel certain kind of social isolation and discrimination at multiple levels, and they also become a point of discussion. Because when you're talking about the qualitative studies, anthropologically or sociologically, we talk about the mind, what is inside the mind of a patient or their families who are actually going through this thing. So what is their perception is that people start a kind of differential behavior with them, which is very traumatic, which is very disturbing, and in a way they all go through, I mean, some certain kind of distress and anxiety. On the other hand, what happens is that given the fact their income is already limited, what happens is that major portion of their income is directed in a certain way. What happens is that the other family members, particularly the siblings who are also the kids of school going age, they don't get the right opportunity, they don't get the proper attention of their parents, and proper mechanism which can enforce and which can help their healthy growth. And what happens is that some of the case studies were so disturbing that these families, because this is a genetic problem, so it carries forward in multiple children. So when the family has 2 or 3 kids, and I have so many stories that where there were number of kids with this disease were more than 1, so it was really very disturbing. So I talk about the lack of awareness, which makes the thing very complicated, because when you talk about premarital screening, we met a family where they knew that the person knew that premarital screening is important. He was already a carrier, but unfortunately, the person whom he married was also a carrier. So it means that then they said that they adopt a healthy mechanism, that they went through CVS and for further pregnancies, and when they were planning, they try to rule out that what can be the best solution. So this is the factor where education plays a very important role, and lack of awareness is one factor, because you see in our culture cousin marriage is very common, and with this problem also there are also other genetic problem, but we are talking particularly about this problem. So I think that the role of the sociologist and people like us and our students, we have to reach far from our desk and to the community, and raise the voice of the community and make it, heard at multiple levels, at multiple channels, so that it becomes the voice of the policy, so that it becomes the voice of a common person who needs a certain kind of help in a particular way. Because until and unless you don't make the 60 million population of your country aware of a certain thing, either it is cancer, either it is thalassemia, or any other thing, any other social problem, how can we think about sustainable development and inclusive development overall? So it's a big question mark for all of us. So how to go about it? There is a long way forward, but I am always optimistic, and there are ways where we can, Dr. Nora talked about synergy, she talked about collective effort, collective wisdom. We need to listen, we need to encourage people so that they should not feel worthless. Every life is important, and it is important that from their current position they have to move forward and address in a better way. For this, we have to, deconstruct their belief system, and then we have to reconstruct what is progressive, what is important, and and for this, and to avoid social stigma, we need certain social capital at the level of the community, at the level of different agencies, and when health sector, where we are usually, I see that I have worked with London School of Hygiene and Tropical Medicine, I have worked with Population Council, I have worked with the Asia Foundation, and I have worked with the National AIDS Control Program, and I have worked with so many other health channels. But the problem where I figured out the bottom line was, there were least informed about the people for whom they were actually working. So the gap which was not being bridged in the policy, not being bridged in the projects, and the major cause of the thing is the lack of ownership and the lack of voices that comes from the grassroots. So that is important, that how we prepare that level, and how we address through academia, through industry, through health sector, and through policy making, and have such reflexive efforts which could bring more fruitful results. So I talk about the transport problems, and I talk about the accommodation problems when the family travels, and then it has a significant effect on their income, and they are just dropped from their level of you can say income group in a certain level. They go at times below the level of their monthly incomes, and then they have to borrow money, and they go under huge debts and under huge suffering. So lack of attention to other children, other kids of their family, and so their experiences are varied, their experiences are difficult to absorb even. So what we can learn from such initiative, and what has come up from this study, is that there is a substantial percentage of families, particularly less educated and low income families, who remain unaware of this disease. And then these groups are highly pressed by socioeconomic, cultural, religious factors surrounded by this disease, because it's very difficult to talk about a disease in public and get the people understand that what kind of efforts are needed. Because if the community owns certain things, and if the community understand, be it the role of the NGO, be it the role of an individual, be it the role of the government, every step is important, and every little step counts, which is worth making a dent. Because if I talk about a drastic change and it can go in one click, it cannot be done. So basically we need to educate people both formally and informally, and then address the socio-economic restraints that hinder the families to address the things properly. And then there are, the important point is that limited availability of safe mechanism, because people go to different clinics, quacks, then to a better facility for blood transfusion, but they are in all these steps, these are quite vulnerable. And another topic of study, that what happens, this is another dimension, which is I can safely say that that is not safe even, and that makes the people more vulnerable towards associated problem diseases and treatments, which is another big task requiring big efforts. So some of them can be hepatitis B, HIV, or C among the individuals with this disease, thalassemia, due to blood transfusion. Because of this problem, they, I mean, inherit, or they get exposed to different other things. So not inherit, but they get exposed to other diseases. In order to reduce the burden of thalassemia in Pakistan, there is a dire need of awareness among general public, and then particularly among low social economic people with low education. And this study is quite limited in its scope. As I mentioned, more such studies are required, where we need to have more qualitative studies, more people-centric approaches that can address that, how it was understood, what the people want, how they want, because it is very difficult to for people to get out of their culture, because they have been culturally conditioned. For them, going to a saint is more important than going to a doctor, because you cannot change their mindset at once. For changing that mindset and bringing them on a certain parallel thing, it is a big task. So for this, we have to work at the grassroots level, so that it can be safely stated that there is a dire need for a comprehensive national policy that should address various stakeholders with an inclusive bottom-up approach, with present us multiple ways to address the problem. Thank you very much. And with this, I have to just finish my activity, because I have another call. Please, Isha, take up now.
Oh,
thank you so much.
okay.
Thank you.
Thank you so much, Dr. Nazia, for your beautiful presentation. Now I would like to invite our last speaker. Our third speaker is Dr. Kamran Ishfaq. He is the chairman and associate professor, Department of Sociology from Maudin Zakria University, Multan. He will address our audience on beta thalassemia, a global public health problem, the role of medical sociologists and anthropologists. Over to you, Dr. Kamran.
Okay, thank you very much. And especially before starting my talk, I really appreciate the efforts of Dr. Adila Rahman. She is in charge of Department of Sociology, Fatima Jinnah Women University, and convener of today's summit. And especially I'm very impressed and very thankful to Professor Dr. Saima Hamid, Vice Chancellor of Fatima Jinnah Women University, for giving permission to Dr. Adila Rahman for organizing a very important international world summit on medical sociology and public health. So, and I really thankful to Professor Dr. Ahmadullah, is a session chair of today this session. So, Dr. Nazia Rafiq, she really shared the very important findings about her study assessing the impact of socioeconomic problems on families of thalassemia patients. So my topic is beta thalassemia, a global public health problem, the role of medical sociologist and anthropologist. So I just want to start my talk. Yes. Already, Dr. Sabha, well, thalassemia is an inherited blood disorder which is passed from the parents to their children. And thalassemia is a major public health problem, not only Pakistan, around the world. And in Pakistan, 5 to 8% and 9.8 million of the total population in Pakistan, they are suffering from the genes of thalassemia. And around 5,000 to 9,000 thalassemia major patients yearly, they are identified with the disease of thalassemia major, and they depend on the regular blood in Pakistan. So the main factors are endogamous marriages in Pakistan. In Pakistan, we all are knowing Pakistan is a male dominant culture where male is the final voice and authority. And Pakistan, mostly whenever a child suffers from the chronic disease, mostly we blame to our female. If he or she, they are suffer from any kind of chronic ailments, we mostly blame to our female that our child is suffering is due to the reason of mother. So this is the genetic inheritance of the thalassemia. According to medical science, when both people, male and female, if they are having thalassemia minor trait and if they marry, there will be the 25% chances that their coming born baby will suffer from the disease of thalassemia major, and they will depend on the regular blood. On monthly basis, they will require the blood. And if the both minor marry, there will be the 50% chances that coming born baby will suffer from the disease of minor. Thalassemia minor means that children, they will not require the blood, but they will be the source of thalassemia major children. And only 25% chances are, if the husband and wife, they both are minor, 25% chances are their coming born baby may be normal. So 75% chances are affected, and the only 25% chances are their coming born baby may be normal. So in Pakistan, Thalassemia Federation is working well, and about 25,000 patients are registered with the Thalassemia Federation of Pakistan. But these figures are not giving us the exact picture, because majority of the patients' families, they are living in the rural areas and they are not registered with any thalassemia center. So 25,000 only patients, they are registered from the Thalassemia Federation of Pakistan. So here is the picture of thalassemia major patients, because moreover the thalassemia patient required the regular blood and iron chelation therapy that puts the financial burden on the patients. So only cure of this disease is bone marrow transplant, which is beyond the limit of the parents. So thalassemia is a preventable disease, as Dr. Nazia Rafiq said. It's a preventable disease. The issue is, in Pakistan, many of the social scientists, many of the clinical doctors, they work well, but the issue is, up till now, no national screening program is made in Pakistan, and only few non-governmental organizations, they are working in their own capacity. So in Pakistan, the public awareness program about the disease is very low, and parents of the thalassemia children, they are having very low information about their child disease. So most effective way for the thalassemia prevention is mass education through print and electronic media, symposium, seminars, training of practitioners, and the training of the social workers, gynecologists. So with the help of medical education, we can prevent our children from this deadly disease. So the efforts have been made globally to prevent thalassemia through the mass education throughout the world. Countries, different developed countries, they eliminated this deadly disease from their countries with the help of extended family screening, premarital screening, prenatal diagnosis. And it is mandatory for the successful thalassemia prevention program that all the stakeholders, print and electronic media, religious scholars, pediatricians, gynecologists, thalassemia families, non-governmental organizations, and the government, they should play their important role. So this is the picture of thalassemia center in Multan. In Multan, Children Hospital Multan, we have, and more than 2,000 children, they are registered with thalassemia department, Children Hospital Multan, and monthly basis they receive the blood, monthly basis they receive the medicines. Medicines are very costly. Already Dr. Nazia Rafiq said that they are facing many problems. Parents particularly, they are facing many socioeconomic and psychological, and because the medicines are very costly, and they are facing the social stigma from the society, because due to their thalassemia major child, and even sometimes they are unable to attend the social gathering. Just the reason is their child, they are suffering from thalassemia major, and they need blood and they need their attention. So global scenario of the thalassemia prevention strategies are, so I just want to share with all of you about the global scenario. The thalassemia perhaps a decider for which efforts has been made globally to prevent this disease with the help of medical education, extended family screening, premarital screening, and prenatal diagnosis. So in Turkey, Greece, Iran, Canada, America, they totally eliminated thalassemia major disease from their countries with the help of premarital screening. So in these countries, all married couples are mandatory to get the thalassemia test before the marriage. And similarly, in Saudi Arabia, UAE, premarital screening is compulsory. And in Iran, the birth of thalassemia decreased but not eliminated the disease altogether. So thalassemia registry is not available in Pakistan. The diagnostic test for the thalassemia are available only in larger cities. And there is no thalassemia screening programs at national level. So what we can do, what is the responsibility of the doctors, clinical doctors? No doubt the clinical doctors, they are playing their important role. They are treating the thalassemia major patients clinically. They are doing research in the clinical side. They are working well. But the role of the sociologists, medical sociologists, and the medical anthropologists are, so we are the doctor of society, we are the social scientists, and it is our responsibility to guide to our general public, and we can start different campaigns like medical education. We can start, and with the help of mass education, with the help of extended family screening, genetic counseling, prenatal diagnosis, we can eliminate this deadly disease from our Pakistani society, Pakistani country. So mass education, being a sociologist, being a medical sociologist and medical anthropologist, what we can do, we can start mass education in general public and even extended family screening. So most effective tool for the prevention of thalassemia prevention is mass education through seminars, through debates, through symposium, through community health education, and the training to the general practitioners, doctors, social workers, nurses, journalists, and even we can convey this message regarding the prevention of thalassemia through the print and electronic media. The next one is how we can control, being a medical sociologist, being a medical anthropologist, how we can control this disease. In Pakistan, particularly in Punjab, Punjab thalassemia prevention program is working well, but it's working only in Punjab. We have other provinces. The issue is in Punjab, thalassemia prevention program, Punjab thalassemia prevention program is only working in few larger districts, not they are covering all the Punjab. So with the help of thalassemia prevention program, even we can start extended family screening, because extended family screening is very important to identify the carrier thalassemia rates in the community. And the thalassemia patients, you know that basically the thalassemia patients, they are suffering this disease, just the reason is due to endogamous marriages, because endogamous marriages are very common in Pakistan. And however, before the marriage, the thalassemia screening test must be mandatory in Pakistan. The next one is the genetic counseling. After the extended family screening, genetic counseling needs to be offered to affected members of the family, because the purpose of this counseling is to inform the married couple and unmarried individuals regarding their chances of producing thalassemia major child. And the next one is prenatal diagnosis. The clinical doctor, mostly they perform prenatal diagnosis with the help of CVS. CVS is a chronic Wills sampling. So mostly gynecologists, they perform this test, and whenever the husband and wife, they both are minor, and before start the heartbeat, even the female, even they can visit to the gynecologist, and the gynecologist, they can perform the CVS test. And with the help of CVS test, clinical doctors, they can identify the either the coming born baby will suffer from the thalassemia major or not. If they will suffer from the thalassemia major, being a Muslim, we are having a fatwa, and we can abort when we observe that coming born baby will suffer from the chronic ailments and will be the burden of the family. So we are having option. And otherwise, if a baby is normal, then we can carry. So this is basically information we can provide to the thalassemia family as well as in the general public. So in Pakistan, different non-governmental organizations and welfare societies are working for the important cause of this under the umbrella of Thalassemia Federation Pakistan, but no serious efforts have been made by the Pakistan. So Punjab Thalassemia Prevention Program is working only in a few bigger districts, as already I said, and no, they are providing the state-of-art services only. They are just working in the few districts, and it should be, because this project is state-of-art, and this kind of project should be in different districts, in different provinces. So it is strongly recommended that the organized national thalassemia prevention program must be started at the national level, and emphasis on the screening in schools, colleges, universities, And the government of Pakistan must pass the law on premarital screening and strictly implement this as at grassroots level, because developed countries like Canada, America, and other South Asian countries particularly, they eliminated this disease with the help of premarital screening. They are having, they compulsory ban that before marriage, the couple will go for the screening, and after screening, they will be allowed to marry. So with the help of this premarital screening, developed countries, even in Iran, Turkey, Greece, America, Canada, even Saudi Arabia, they eliminated this deadly disease. But in Pakistan, we are still working on the prevention strategies. So Pakistani government should pass the legislation, as already I said, that regarding the mandatory blood screening test for the couples before marriage at federal, provincial, and district level. So for the prevention of thalassemia, it is important that the medical sociologists, anthropologists, social workers should raise the awareness among the general public about thalassemia disease and its prevention. So there is a need to organize the workshops, seminars, lectures, and we can arrange the different conferences, and we can share knowledge among our young scholars as well as in general public with the help of different academic and activities. So health department should strengthen the awareness of the thalassemia among the national authorities for its inclusion amongst the national agenda priority items regarding the premarital screening law. So this is the picture. Even 25th October 2021, we arranged thalassemia awareness and prevention seminar in Bahauddin Zikra University Multan, and we are in Bahauddin Zikra University Multan. We are having a more than 40,000 students, and we have started this kind of campaign from our department, and we are arranging monthly seminars, thalassemia awareness and prevention seminars in the different departments. The purpose is because our students, our enrolled students, they are having more than 35,000. In future, they have to start their practical life. So we are trying our level best, being a medical sociologist, being a medical anthropologist, we are trying our level best to convey the message regarding premarital screening, extended family screening, and the prenatal diagnosis, and how we can educate our general public. So as the Dr. Nazia Rafiq said well, it is the responsibility of every individual, every citizen of Pakistani. We should work collectively, and we should raise this voice how we can prevent this deadly disease from our Pakistani society. So I am confident when we will start this kind of campaigns, and when our medical sociologists, medical anthropologists, when they will work hard and when they will convey this message regarding the prevention of thalassemia, because the prevention is better than cure. Rather, we spend our medical budget on this only thalassemia disease. With the help of medical education, we can overcome and we can eliminate this disease. So I am confident a day will come when this deadly disease will be eliminated from our Pakistani society. So thank you very much, the participants, for listening from my side. And if you have any question, you can ask to me. Thank you. Thank you, Isha. Please continue, proceed.
Thank you so much, Dr. Kamran. Thank you for your thought-provoking words. Now the session is open for the question and answers.
Yes, dear participants, if you have any question regarding today's presentation, beta thalassemia, a global public health problem, the role of medical sociologists and anthropologists, you can ask. You can share your experience and you can ask any question to us.
You can raise your hand.
I think there is no question.
So we can move forward then.
Yes, you can proceed further.
Okay, Dr. Namatullah Ashmi, I would like you to conclude the session and also give some reflection on the medical sociology and anthropology, please.
Bismillahirrahmanirrahim. Can you hear me, please?
Yes, sir.
Honorable Vice Chancellor, the host, Dr. Villa Seba, and the three learned speakers, Dr. Noora Zora, Dr. Kamran, and Dr. Nazia. And the mediator, Dr. Isha. It is really a matter of proud for me to join the conference, to attend the scholarly lectures of the three scholars. It is the reality that I known to the importance of medical sociology in such a deep level today. And it is due to the opportunity provided by Dr. Adila, the host. All the three lectures very expressive, very important in the interest of human interest. If you are honor allow me, so then I will start from Dr. Noora Zora lectures, research. Her findings, recommendations are in the post-COVID era, relates to post-COVID era. It's good. Choice is very good of selection topic. Choice of topic is very good. Past is past. Done is done. No, it is the time to heal the wounds.
ग्रामर सीख लो उसकी मैंने मैम ज़रा को दी मैम ज़रा उसकी वो बुक पढ़ी है मैंने वो दी है तो वो हम पढ़ते नहीं थे अब हमें मसला हो रहा है
I would like to name her title more with regards to its importance, making the unprivileged people stand. It is very important in the interest of any nation, in the interest of in the interest of justice, to make the unprivileged people stand in the society and make their contributions. Her qualitative descriptions made through reflects that people want to contribute, and it is the need of the society to make them stand. I would like to use the word make stand instead of empowering. It is so important. It is so important in the context of. And other thing is, if you do not empower people, if you do not value the people, harmony, order in the society is very difficult. It would be injustice on the part of the other society, on the part of government, to ignore such people. If you want a better output, if you want to reduce your control crime, ratio of crimes, you will have to make the justice. You will have to address the post-COVID era, which is very important, and it is not important. Her research is not important in the context of Indonesia, Pakistan, but in the context of whole humanity, universal importance, especially the underdeveloping countries need it with more strength. Another thing is, a good suggestion is from Dr. Noora Zora to contact the individuals, to contact the persons at individual levels, in the context of their culture, in the context of their mobility, in the context of their limitation. In the context of But the issue is, who will do it? The important issue. Who will do it?
अच्छा आप
Who will make the people empowered? Who will make the people stand? Just see the example of Japan. Tsunami. People put their beds out their doors to the suffered people so they can bathe and they can spend their nights. And the Queens in 2011 acknowledged the Japanese people for their help to the unprivileged people, to the unempowered people, for empowering or making them stand. This is another example from our Islamic history is the Hijrat-e-Madinah. How the people supports the unprivileged, powerless people, helpless people to make them stand, to empower them, and in the long run, they ruled the world. They conquered the world. They introduced a civilization, and this it was just started from the sacrifice, just from this. Another aspect, Dr. Noor Azhara researches on many aspects.
अच्छा आज ये सही बोल रहा हूँ ना?
Another aspect is on the part of the social structure. She suggested to revisit the people. I would like to add in her findings. I would like to suggest revisit the social structure of the country, social structure of the society. The structure should have the potential to support the people. Time B, the greatest historian of the world, said in The Rise and Fall of the Nations that the nations who face the challenges, civilizations grow, their civilizations grow. And the nations who cannot face the challenges, their civilization falls. The only principle. If we face the challenges, then we can do it. Who will do? Dr. Noor Azhara research commitment. She asks for the commitment, whether it should be commitment on the part of society, charity organizations, religious organizations, NGOs, or governments. Society should stand for it and do it. This is very important. The second, I would like to appreciate Dr. Kamran Ishwaq, and he pointed out thalassemia, aspects of thalassemia. It is astonishing that 5 to 8% carriers of is alarming figure. 9.8 million people suffering in Pakistan. A nation which is already unhealthy, poverty facing, injustice, prejudice, terrorism, Turan. If the people are, if the such a majority of the people, newborn people face this problem, this is alarming in the interest of the development of the nation. How can we develop? If such a so big number is unable to perform due to their health conditions, health is the first. And other thing which he pointed out, in rural areas, it is too much. It proved that it is the endogamy which is causing these problems. And what I concluded from the research, it is the pure, it has the pure sociological solution of this problem. Sociologists have these problems. Medical sociology has these problems. Medical sociologists can make the recommendation and can reduce the ratio of patients of thalassemia, as its treatment is too costly. Transplantation of bone marrow, this is beyond the control of middlemen even in the Pakistan. So before marrow test and other tests are only, and I would like to congratulate Dr. Kamran Ishfaq for pointing out, for highlighting a phenomena of very interest in the nation, in the interest of nation, and to develop, to grow. Similarly, Dr. Nazir Rafiq Sahaba pointed out the problems of the parents, how it is serious problem for the nation when there is poverty. They can't afford the expenses to come and go. They can't expenses the blood transmission. So it is difficult for people, and as she suggested, awareness raising program should be introduced, and at community levels, at government level. Similarly, Dr. Kamran put an idea to pass legislation for pre-marital tests of thalassemia. I think these are the solutions, and these must be addressed for it. Thanks a lot again for Dr. Adila for inviting me, for providing me the opportunity to join scholarly lectures and the scholars, and hearing and getting so much information about on the basis of the research of inside and outside country people, scholars. Thank you very much.
Thank you so much, sir. We have some questions in our chat room. Dr. Kamran Ishfaq, are you there?
Yes.
Okay.
Samib.
So you can see the question.
Yes, I see the question from Sami Bibi. She wrote, Pakistani government is not playing their role for thalassemia patients. Who will be responsible? I worked 1 year in Canada, and even I work with the Thalassemia Federation of Canada. Developed countries, they are having their excellent mechanism. In the developed countries, the health and education is totally free, right? But in Pakistan, unluckily, due to certain reasons, our government of Pakistan, they never given the attention on this deadly disease. The issue is, we should raise our voice. Being a sociologist, basically clinical doctors, no doubt they are working well. They are treating the thalassemia major patients, and they advise whenever the thalassemia major visit in the clinics, medical doctors clinic, doctor advise them to arrange the blood, to arrange the medicines, which are very costly, right? So you all are knowing well, in our area, like our majority of the population, they are residing in the rural side, and in rural as well as the urban areas. Parents, they are belonging to the poor socioeconomic background and unable to arrange the medicines, right? In Pakistan, Baitul Mal already working well, and the district zakat committees, different social welfare and Baitul Mal, they all are governmental organizations. They are working well, but the issue is our population is higher and funds are limited, right? So being a sociologist, even the clinical doctor, different researches done by the different countries, even they concluded that rather we spent our huge amount for the treatment of thalassemia major patients, we should raise our voice. We should educate our general public, our thalassemia major families, and we should pass a law, a bill from our national provincial assemblies regarding the premarital screening. As the developed countries, they totally eliminated. Even when I work in Canada, even the Canadian government, they are not having such kind of thalassemia major disease. Even sometimes they identify the cases from the immigrants. So thalassemia Canadian government, even they started such kind of awareness through their syllabus of their children, right? In metric level, even before in the middle level, so they're having different their education mechanism, but they are providing such kind of medical education through their syllabus, and they are providing the proper education in general public, in thalassemic families, in immigrants. So that's why thalassemia cases are very low in number in developed countries. Iran, totally they eliminated this disease with the help of medical education. No doubt in Pakistan, the government of Pakistan, there are different organizations like Pakistan Baitul Mal, Zakat committees, and our social welfare and Baitul Mal, they are working. But the issue is, we as a sociologist, we can play our very important role with the help of medical education, right? So when we will start our medical education, like already you all are knowing well, government of Pakistan, they are working well regarding the eradication of polio in Pakistan, and all the people, all the citizens, even the Pakistani citizens, those are living in the rural areas, in the urban areas, now they are knowing well how important polio vaccination is. So like this, we have to start campaign at national level. When we will start this campaign at national level, and when we will convey our message to our government with the help of our local leaders, MNAs, MPs, how deadly this disease is, definitely with the help of our campaign, we will try to convey our message to the government. Plus, when we will start our medical education, definitely we will be able to eliminate this deadly disease. And already I said in my presentation, I presented one picture. Even in Bahauddin Zikra University Multan, we have started this kind of medical education, and we are arranging different seminars in our different departments because we are having more than 35,000 students. Our target is we should educate our youth, because in future, whenever they will complete their education, they have to start their practical life. They must have a knowledge about the thalassemia and how thalassemia disease occur in their children. So every person, they must have a knowledge. So I hope when we all will work like medical educationists, sociologists, clinical doctors, print and electronic media experts, when we will start this kind of campaign, then definitely a day will come when Pakistan will free from the thalassemia disease. Thank you very much.
Thank you, sir. One more question is from Kabir Khan. In which gender thalassemia is most common in?
Yes, thalassemia is basically common in the male and the female, both equally, right? Because there are the chances, already I said in my presentation, when husband and wife, when they are thalassemia minor, there are the 25% chances that their coming born baby will suffer from the thalassemia major, and they will depend on the regular blood. It may be male and female. We cannot say that females, they are higher in number and male, they are higher in number. In our Pakistani society, already we are knowing well the females are greater in number. So that's why the females ratio of the thalassemia disease is higher. Just the reason is because in our culture, female population is higher as compared to the male. But both cases, like thalassemia, basically it's occurring in the both gender, male and female.
Okay, clear. Thank you, sir. Thank you very much. Any question? Any other question, please? Okay, it was a wonderful session. Looking forward to the new ventures and collaboration with esteemed national and international faculty in future. Thank you so much. Allah Hafiz. Bye.
Thank you, Isha. Thank you,
Allah Hafiz.
Professor
Thank you.
Hashmi sir. Thank you very much. And
Thank you so much.
Noora Zora Mohamdia. Bye bye.
Thank you जी, बहुत शुक्रिया जी. See you next time इंशाल्लाह किसी कॉन्फ्रेंस में मुलाकात होगी. Thank you.